Good afternoon. Happy to be here with you all. My name is Lisa Kelly-Vance, and my primary responsibility in my career is that I train young, energetic graduate students to become school psychologists, a profession that I love and a profession that I did prior to going to the university. So I have some experience, and I worked 0 to 8 as part of my assignment at that time. And I thank you all for allowing me to come here and speak and share my information from the school psychology perspective. And I am speaking on behalf of our National Association of School Psychologists, as well as, I hope, school psych practitioners that are out there doing the job. So I thank you for that. Also, I want to mention that I have my points in a broader perspective in a handout on the table. Thank you to the Institute for copying that for me and making it available. Let me tell you a little bit about the scope of our work in school psychology. We are educational problem solvers. We look at a child's educational needs, and what we ask is, what does this child need in order to be successful in education, in the classroom, in their home, and in life? We're trained to work with children birth through age 21. In both general education and special education. And in that capacity, prevention is one of the keys to our work. The movement toward intervening earlier in our public school systems and general education that's happening at school age, school psychologists have been integrally involved with that, and I see us as being able to contribute to that same movement in early childhood and getting some similar changes and more preventive work. Our primary skills as school psychologists are in the areas of assessment, prevention, intervention, consultation, collaboration, research, and evaluation. Yeah, UNO, we have classes on all that good stuff. So we do provide these services in order to help children's learning, et cetera. And we do provide direct services to children, and we provide indirect or consultative services to the adults working with those children. So that's part of our role. Also, a big part is that database decision making in helping determine what's effective, what kind of programs are effective, and ensuring quality service. And then a phrase I like is, school psychologists are the educators who know the most about psychology, and we're the psychologists who know the most about education. So we're kind of at that intersection of education and psychology. The question was asked about the referrals and linkages and what works best in settings. And my comments are, referrals to early intervention services through special ed come from parents, caregivers, physicians, et cetera, and teachers. I find that once children hit school, the referrals come primarily from teachers. I find in early childhood, yes, the typical referrals come, but I also talk about our grandmothers are a primary referral source, because grandmothers seem to know when things aren't going quite right in their grandchildren's development, and so I hear a lot of grandmother referrals. And in terms of the referrals, the process for special education and early intervention, that's specified by law, but the concern, and this has been mentioned by others, is that when these children are referred but then don't qualify, what happens? And in school age, we do have some services that we can provide, and less intensive services, and they're there because of the structure of the kids being in school. But I find in early childhood there are a lot of barriers there that we can't provide those services when children don't qualify for special education. There are just fewer options to support the family. Okay, so the skills and knowledge that providers need to navigate these linkages between services. I think you're going to hear a few familiar areas mentioned. So what do we need, especially as school psychologists? Number one, an understanding of child development. Used it again, didn't I? And I'm going to phrase it in terms of, we need to understand what children should be able to do, so we know when to refer them for additional services. So that kind of concept of child development. Number two, family systems, culture, and engagement. We need to have knowledge of diverse cultures, language needs, understanding of family dynamics. Number three, and I'm really going to emphasize this one, behavior. We need to understand behavior management, how to improve and help children with their behavior strategies, strengthen their strategies, and we need to help teachers, caregivers, et cetera. Number 4, social emotional skills. We need to understand how children are socialized, to learn those skills that are critical to peer relationships, emotional regulation, coping strategies, et cetera. And we need to recognize warning signs for mental health needs, and mental health needs have been brought up several times as well. Number 5, language. We need to understand and be able to teach effective communication. Number 6, we need to understand learning. This has been mentioned many times, and understand how to monitor progress of that learning. Also mentioned, we need understanding of school systems and law and community school partnerships. What are some of the challenges? Well, a lot of times, especially in school age, when we're dealing with more 5 to 8, that schooling and teaching is focusing a little bit more on the academics than educating a whole child. And I think that sometimes works against children getting the services they need. Also, as mentioned before, there's a lot of need for more services, more connections for kids. And one other panelist mentioned the issue of the switching of services from 0 to 3 to the 3 to 5 and beyond, and that I've seen time and time again is extremely difficult for families to navigate. Why do you care about the family in 0 to 3, and then you just care about the focus of the child after that time? We also have some policies that are kind of exclusionary for kids in early childhood with behavior problems. I'm finding that there's a higher and higher number of children getting kicked out of preschool, and I don't know if you see that, but I think we need more strategies to prioritize helping those children with positive behavioral strategies and supports. Let's see. There are a lot of our practices that have been mentioned too that are not as child-focused. I want to put in a plug for one area I'm very familiar with, and that's the area of play and making sure we have more and more opportunities for our children to be able to play and learn skills through play and developing in that way. I think, grab a drink real quick. The areas that have been mentioned that our profession needs to know, or the areas that our profession needs to know, are similar skill areas of everybody else here. My laundry list: database decision-making, evidence-based school interventions, early childhood interventions, preventing school failure, consultation, collaboration. I could go on and on with the list that really overlaps everything everybody else has said. So I'm hearing a lot of good overlap in terms of skill need and skill development. But what I want to do in my last couple of minutes here is emphasize 3 key messages through an example of a girl that I knew when I was a practitioner. And I'm going to say the key message, the key point, and then how I worked with this little girl, not just me. The key message, the first key message I want to say is, we must meet the needs of the child. It's an oh duh moment, right? But I want to comment on how this is true for a little girl that I met. Her name was Sophia, and I met her when she was 2 years old. This child eventually was diagnosed with autism, and I would say she was one of the more severe cases that I had personally seen. Our multidisciplinary team worked together. We assessed all areas of her development: medical, cognitive, everything that's been mentioned. We then determined the appropriate interventions for working with Sophia. Point 2, we cannot wait for children to fail before we meet their needs, and this is nowhere more true than in our 0 to 8 population. For Sophia, we started interventions early, at age 2. When we were in the process of still assessing her, we were intervening at that same time. The interventions were very intense. Took a lot of resources, a lot of people, a lot of training. The whole team was trained on these intervention techniques. My third point Collaboration with the family is essential. That was especially true in Sophia's case. The team and the parents didn't always agree on what was best, but we worked together and we focused on the family's needs and priorities. Those became our priorities. And we worked together to achieve those. And the great news in this story is that the efforts paid off. So we met her when she was 2. We worked as a team for those following years. And then when she went to school, Sophia was fully mainstreamed. This, again, I'll remind you, a very significant case of autism when we saw her. No language, that there was little hope in a traditional sense. Fully mainstreamed through her K-12 education. And I just recently heard that Sophia is enrolled in college now. And that, to me, means the work we do in early childhood is critical, it's important. We need to be working together as a team to make all of this happen. And we need to remember that when we do this work, we are being preventative. A lot of people talk about the money we save by being preventive in 0 to 8 population. I agree with that, that's wonderful. But I also want to think we are also preventing a negative life experience and creating positive life experiences by getting the intensive services at a very young age. I'll leave on that note.